Hello, everyone. My name is Dr. Nikki Harris, and I am the chair of the District 9 Young Professionals Committee. On behalf of myself and the entire YP committee, we want to thank you for the opportunity to be here at the Athletic Training Student Symposium. If you are here, you have already taken a meaningful step toward developing yourself as a professional, and as you proceed throughout your education and eventually throughout your career, you will begin to understand the critical importance of communication in the workplace. Right now, your workplace will primarily include your classmates, your teachers, your preceptors, and your patients. While these relationships may expand to include peers, important stakeholders, and other members of the healthcare team, as you transition into your clinical immersions and your clinical practice, the foundations and principles of effective communication will remain the same. Let's get started. Take a few minutes to read this. I know you believe you understand what you think I said, but I am not sure that you realize that what you heard is not what I meant. What are your thoughts on this statement? The wise have suggested that the single biggest problem in communication is the illusion or the assumption that it has occurred. How many times have you assumed someone knew what you were thinking, but then realized you never verbally said it? Workplace communication is defined as the process of exchanging information and ideas between one person or team and another person or team within an organization. Your team may include classmates, athletic trainers, athletic directors, team physicians, other healthcare providers, your employer, or your preceptors. Your workplace team will vary throughout the course of your career. What is your communication style? You have a particular style of communicating, of course, but do you know what it is? Do you know its strengths, its weaknesses, how it compares to the style of others? The key is understanding your own communication style so that you can match it to that of your audience. This is the essential step of effective communication. There are four main communication styles: passive, passive aggressive, aggressive, and assertive. Understanding different communication styles can radically improve the quality of your relationships. Passive communicators are the individuals who just go with the flow. They often are misunderstood because they have difficulty and fail to express themselves and their opinions. For that reason, passive communicators tend to give in and to yield to others. They sit back and listen as others express themselves. When asked to perform a duty or a task, they seldom say no. The failure to express their thoughts and emotions often leads them to feelings of disappointment, of anger, and of resentment. Likewise, they do not respond well to hurtful or anger inflicted situations. On the other hand, aggressive communicators take things to the other side of the spectrum. People who rely on this communication style in the workplace tend to dominate the conversation. They may be self centered, as well as loud, opinionated, and demanding. They may be condescending, asking questions in a rude manner, and failing to listen to others. They frequently interrupt the conversation. With that being said, aggressive communicators speak their mind even when it hurts someone's feelings. They point fingers and often blame others for their mistakes. Aggressive communicators frequently criticize, intimidate, and threaten others in the workplace. If you have ever met an aggressive communicator, you know that they can be tough to deal with. Therefore, conflict with these individuals does not usually get resolved. Passive aggressive communication is a combination of passive and aggressive forms. These individuals seem passive on the surface, but have a hidden resentment or anger that appears in subtle, indirect ways. Passive aggressive communicators are sarcastic, so you will frequently hear things like, "It was just a joke," or "I was only kidding." These individuals have difficulty acknowledging their true emotions. Their words do not align with their actions, and their facial expressions and body language does not match that of their words. Rather than expressing their ideas or concerns within a project, passive aggressive communicators will hit you with the "fine, whatever" response during meetings. Lastly, assertive communicators effectively express their own desires and needs with confidence, thus making them great leaders. These individuals use lots of "I" statements while maintaining good eye contact when speaking. They encourage open and honest dialogue while still considering the needs of others on their team. I personally admire these individuals because they have the ability to set boundaries and say no with confidence. While assertive communication is deemed the most effective communication style, the good news is that if assertiveness does not come natural to you, it is a skill that can be learned, modified, and improved through deliberate effort over time. Growth in your communication style helps promote healthier interactions with your classmates, your faculty, your preceptors, your patients, your coaches, and other individuals around you. In addition to these basic styles, we can further classify communication by preference. Preferences include analytical, functional, intuitive, and personal communications. No one of these preferences is inherently better than another. However, picking the wrong style for a particular audience can cause trouble. Learning to build flexibility around your preferred style allows others to more successfully hear the important messages that you need to say. If you are an analytical communicator, you prefer hard data and real numbers. You like objective measurements of success or failure. You prefer very specific language and tend to be suspicious of people who aren't in command of the facts. For example, an analytical communicator will not be satisfied knowing that the athlete has made a positive improvement after surgery. An analytical communicator will want to know the specific progress or measurements that led an individual to gather that conclusion. As a preceptor, they will want to know, did the patient gain 25 degrees of knee flexion as measured by a goniometer, or did they improve 20 points on their patient-rated outcome measure? Again, looking for specific hard data or real numbers. Also somewhat analytical, functional communicators like process, detail, timelines, and well thought out plans. Functional communicators like to communicate things step by step to ensure that all details are hit and nothing gets missed. When working on a team, this individual is the implementer as they can follow through detail-oriented processes. This attention to detail also makes them very good devil's advocates when strategizing solutions to problems. However, on the downside, their attention to processes and details may make them boring as they tend to lose the attention of their audience. These individuals do not work best with intuitive communicators who like to see the big picture, who skip the details, and jump right to the final product. As an intuitive communicator, you like the big picture. You avoid getting bogged down in details and you cut right to the chase. You don't care to hear things in a step-by-step manner, but rather you want a broad overview that lets you skip right to the end point. You just want the cliff notes or the study guide. You are comfortable with big ideas and you are not afraid to think outside of the box. Because you think big, you also enjoy challenging convention. Intuitive communicators do not want to do things a certain way just because that is how they have always been done. On a positive note, intuitive leaders are quick and to the point. Their meetings are quick and easy, and they do not drag them out for the sake of being there. On the downside, however, the fact that they sometimes lack patience can cause them trouble when in a situation that actually requires getting to the nitty-gritty of things. Your lack of patience may cause you to risk missing an important deadline or missing an important point along the way. Intuitive communicators often butt heads with functional communicators. As a personal communicator, you'll be the storyteller. You value emotional language and connection and use that as your mode of discovering what others are really thinking. Personal communicators are the warm and fuzzy type. They find value in assessing not only how people think, but how they feel. These individuals tend to be good listeners and diplomats, and they are the individuals that you go to in times of conflict because they are great at smoothing over issues and prioritizing healthy relationships within the workplace. Whatever your style or preference, important communication needs to occur between you and other members of the team. In athletic training, workplace communication will be required amongst a variety of different teams. These teams may be intradisciplinary, including people from the same discipline, or interdisciplinary, including people from different disciplines. They may also be intra-departmental, including people from the same department, or interdepartmental, including people from different departments. As a reminder, you can often be one or more of these different types of teams. Intradisciplinary professionals come from the same areas of expertise and can help each other work towards a common goal. Sometimes this may include a head athletic trainer and an assistant athletic trainer working together to treat a patient. Interdisciplinary professionals from different areas of expertise still work together towards achievement of a common goal. A good example of this may include an athletic trainer and a team physician. Intra-departmental will usually include two athletic trainers, possibly in physician practice or in another discipline, working from the same department towards a common goal. Interdepartmental also includes two people from different departments working for the same goal. A good example of interdepartmental work might include a cardiologist working with a radiologist to perform a diagnosis for a patient. Regardless of the type of teams included within your workplace, your individual success depends on the success of the team. For this reason, it may be helpful for the team to establish and agree upon group norms or guidelines that help the team function smoothly. What are some group norms that you would consider establishing? Some examples of reasonable norms for the workplace may include that all individuals of the team attend all meetings, arriving on time, and staying for the entire duration of the meeting. It may be assumed that all individuals of the team speak up and play an active role when in a group setting. That we respect the ideas of all members of the team and those who provide input. That we follow through on obligations that have been assigned to us or agreed upon. That we share the workload equally amongst members of the team. That we cooperate and provide assistance when needed or requested. That we focus on solutions instead of problems. Or that we serve as a leader and a follower when needed. Teams function most efficiently when members share a common understanding of each other's roles and responsibilities. Often, one of the reasons why teams fail is a lack of clarity amongst team members regarding their respective roles and responsibilities, as well as the expectations that they hold of one another when working to accomplish their shared goals or objectives. Likewise, when roles and responsibilities are clearly defined, team members are more productive. Role clarity decreases duplication of effort, miscommunication, confusion, disappointment, and frustration. When roles and responsibilities are clearly defined, team members look beyond their own individual positions, and learn to understand, respect, and value the unique contributions of one another. Furthermore, they recognize that the overall success of the team is a result of shared responsibility and ownership. Whether it be a new clinical site, job, or practice setting, it is likely that entering a new workplace will come with some level of ambiguity in regard to your roles and responsibilities within the team. One possible method of tackling this awkwardness, uncertainty, and potential hazard is to sit down with your direct supervisor, as well as other members of your team, and create a decision tree. The decision tree serves as a model for setting clear expectations and creating a plan that eliminates ambiguity in decision making. When creating this tree, you will want to determine where your responsibilities lie within the four types of decisions. Leaf decisions are those in which you are free to act upon without reporting to a supervisor. What are some examples of leaf decisions? An easy one might be selecting which type of tape to use when applying an ankle tape to a patient. Branch decisions are decisions that you are free to make and act upon in response to an event, but should be relayed to your supervisor within a timely manner. Can you think of some possible branch decisions? Likewise, trunk decisions are those in which you may ponder and suggest a potential solution. However, the solution should be reported to your supervisor and essentially approved prior to acting upon. Lastly, root decisions are those that should be made with input from all of the stakeholders involved. We like to gain input from everybody before moving forward with any changes to the plan. Pillars of effective communication include making sure that your communication is complete. All relevant information must be included. Second, communication must be clear. Information to be relayed must be communicated in a way that is plainly understood by the receiving party. Third, communication must be concise. While the message should be thorough and complete, it must also be concise, ensuring that only necessary information is conveyed in a brief and efficient manner. Lastly, communication should be timely. Information should be offered and requested within an appropriate time frame. Some of the most important communication that you will exchange in the workplace will involve information regarding your patients. This may involve reporting evaluative findings or status changes to a preceptor, physician, or other healthcare provider. SBAR is a technique for communicating critical information about a patient's status to other members of the healthcare team. In your report, you will want to include the situation. What's going on with the patient? This might include their chief complaint and their functional limitations. You should also include a brief background on the situation for context. Examples of this might include past medical history or playing status. In addition, it is critical, but often missed, you need to provide an assessment. This might include an official diagnosis, a differential or working diagnosis, or a simple assessment of the most pressing problem ahead for the patient. And lastly, it is important that you provide a recommendation or a solution for the problem. What would you do to correct the problem or remedy the situation? You should include this in your communication to the healthcare provider. Depending on your role within the team, there will often be times when you will need to communicate feedback to other members of the team, such as students, mentees, or subordinates. Communicating feedback should be done in a delicate manner. This includes being timely, focus on debriefing situations or events as soon as possible after they have occurred. This also includes being respectful. Feedback should be delivered in fairness and in consideration of a team member's feelings. It should be focused on behaviors and not on the individual's personal attributes. Direct feedback to an individual, whether positive or negative, should always be delivered in private. Whether positive or negative, people do not enjoy being embarrassed in front of their peers. Furthermore, effective feedback must be specific. Feedback should be limited to a specific task, behavior, or situation that requires attention or improvement. Be specific and provide actionable items. Lastly, communicating feedback should always focus on directing improvement. Both parties should be committed to developing strategies for improving the situation, the task, or the behavior. In an effective organization, receiving informal feedback on individual tasks, situations, or behaviors should be a regular occurrence. It is important to remember that all feedback is perception. Just because you are receiving feedback on one item doesn't mean that it's an overall performance review. When receiving feedback, try to put your emotions aside and be an active listener. Active listening requires listening first. Listen to the message, analyze the tone of its delivery, summarize the message in your head, and then repeat it back to the giver to ensure their communication was delivered clearly. Once the giver has been given a chance to agree, add to, or clarify their communication, Thank the giver for their feedback. Thank or provide praise to the giver regardless of the content of their message or whether you agree. It is not about being the bigger person, rather about building your reputation as somebody who genuinely is interested in receiving feedback. If you are comfortable with the feedback because it was specific and understandable, your interaction with the giver may end here. However, if you feel the feedback was less, asking the giver questions is entirely appropriate. Appropriate questions to ask might include asking for specific examples or for actionable items for improvement. No matter how prepared you strive to be, it is inevitable that at some time communication will fail. Workplaces offer the opportunity to be in community with one another. Most of us would be happy to report that we have a school family or a work family. We know that we are all in it together. Often conflict is incited when team members' viewpoints don't coincide with that of the decision maker. When conflict occurs in the workplace, it breeds a cold silence that hinders collaboration. It leaves team members feeling as though they are being taken advantage of, and it often results in them turning away from individuals that are difficult to deal with. This conflict can be taxing on the relationship of the parties involved and toxic for the overall work environment. Conflict is costly to the organization. It decreases productivity, it decreases morale, it decreases revenue, it disrupts communication, and ultimately it decreases our patients' outcomes. Dr. Jane Dutton describes compassion as an irreplaceable dimension of excellence for any organization that wants to make the most of its human capacities. Often, an organization's human capabilities are its greatest resources. For the greater good of the team, sometimes compassion requires the ability to ignore small disturbances and respond to inappropriate behavior without escalating the situation. For example, if someone makes an inappropriate joke or talks smack about a peer, sometimes the best response is nothing at all. If nothing happens, no one agrees, or no one laughs in response to the behavior, the individual is unlikely to make the remark again. To quote the rapper Big Sean, the quickest way to let something die is a lack of attention. On the other hand, compassion may also require having the courage to speak honestly about what is unacceptable and potentially harmful to the organization. Demonstrating compassion in the workplace can be done by maintaining a positive default assumption. Assume that others are good, capable, and worthy of compassion, even in times of conflict. Furthermore, compassion can be awakened by practicing attunement. This is the act of being aware of another person while also being aware of yourself. Often we are so preoccupied with our own responsibilities and deadlines that we fail to miss the distress of others around us. Struggles in one's personal life can often be masked by missed deadlines, errors, or misplaced blame during their work performance. Rather than defaulting to negative assumptions, initiate conversation, show that you care, and ask if something more is going on. Listening empathetically requires us to deeply hear others' perspectives and listen to the emotion behind their words. Even if you can't do anything about it, listening helps validate the concerns of others. All workplace conversations will not be easy. Those that are difficult are particularly awkward and nerve-wracking to initiate. Here's a few general tips to help tackle difficult conversations. First, always rehearse what you want to say prior to setting the meeting or seizing the opportunity for conversation. Rehearsing the conversation allows you to take some time to consider what you want to say, to plan for a clear delivery of the message, and to minimize your frustrations. Second, be direct. Cut out the introduction, the small talk, and the positive reinforcements. The conversation is hard and awkward, but dancing around the issue will not make it easier for any of the parties involved. Lastly, for lack of a better phrase, watch your mouth. Rehearsing prior to delivery can help you choose the right words to say. Words matter. Choose them wisely to help prevent further conflict. More specifically, the desk model is a useful tool that helps structure the conversation in difficult circumstances. This includes describing the situation, expressing your concerns, suggesting other alternatives, and addressing the consequences to the team. A good place to start the conversation is to provide a detailed description of the situation or behavior at the root of the problem or conflict. Be direct and use data, especially objectively, whenever possible. Next, express your concerns regarding the situation or behavior. When doing so, try using I statements to avoid the use of confrontational words. The CUS method can help you gain confidence in making assertive statements during times of conflict or resistance. This includes making statements framed in the context of I am concerned, I am uncomfortable with, I feel this is a safety or liability issue. Despite the use of specific and powerful language, there will be occasions when your concerns are ignored. It is suggested via the two-challenge rule that you assertively voice your concern at least twice to ensure that it has been both heard, understood, and respected by the intended party. The receiving party must acknowledge that your concern has been heard. After 2 attempts, if your concern is still not addressed, consider a stronger course of action, which may include bringing in a supervisor. When presenting your concern for a situation or behavior, it is critical that you suggest other alternatives. Reporting a problem without a solution is just complaining. Suggest a reasonable alternative to the problem. Illustrate a positive outcome and offer a solution. Seek agreement on the positive solution from all parties involved. Lastly, even after agreeing on positive outcomes within the team, make sure that your opinion of the potential consequences of a situation or of a behavior is heard. What are the potential consequences of the situation on established team goals, norms, roles, and responsibilities? Emphasize your concerns and the effect of these actions on the team. Lastly, not all conflicts or disagreements need to be addressed. Mark Twain once said, "If you have nothing to say nothing." It's worth remembering that if you don't know what to do or say, there's always the option to do nothing. Often we fail to realize the power of silence, but there are actually several benefits to a good old-fashioned conversation pause. A pause allows time for the point of a conversation or statement to sink in and gives you time to calm your emotions before saying something you might regret. Furthermore, it demonstrates your listening ability and allows you a chance to develop your next point. The fact of the matter is that silence is awkward. However, there will be many times when awkward silence can literally serve as a superpower. Often, silence is perceived as uncertainty for all parties involved in the conversation. Research by Kaudenberg in 2011 showed that it took only 4 seconds for individuals to deem silence as awkward or disruptive to the conversation. So the question remains, who will break the silence first? Sometimes this uncertainty feels so uncomfortable that it is almost painful. So one party will make any decision just to fill the silence, to obtain closure, and to move forward from the awkward situation. Sometimes this decision just may work in your favor. Silence can be used as a powerful negotiation tool. In conclusion, I want to leave you with a few general points. In summary, it is important to know your communication style. Likewise, you want to familiarize yourself with your own communication preferences, as well as the preferences of others on your team. You should make it a point to clarify your roles, responsibilities, and decision-making power whenever entering a new situation. On an everyday scale, practice attunement in the workplace, being aware of your own emotions as well as those of others around you. When conflict does arise, tackle difficult conversations head on. When negotiation becomes tough, use silence as your advantage. With that being said, we want to take this time again to thank you for listening today. We have left you with some references that you may choose to read in supplement to this presentation. We hope that you enjoy the remainder of the Athletic Training Student Symposium. You will all soon be young professionals, and we encourage you to become connected to the SEATA Young Professionals Committee. Please email us with any questions you may have at youngprofessionald9@yahoo.com, and feel free to follow us on Facebook and Twitter. Again, my name is Dr. Nikki Harris, Chair of the Young Professionals Committee, and I want to thank you for learning with us today.